My name is Catherine Smith. I am an LPN to BSN student at Indiana State University's nursing program. I'll be discussing today early childhood oral health. The PAR, which is the population at risk, are children from newborns to 12 years old, regardless of their ethnicity. Learning objectives. You, the learner, will understand why early oral health is important. We'll recognize the extent of the current problem. We'll identify the risks associated with poor oral health. We'll discover methods to decrease tooth decay. And we'll be able to use the resources provided to help educate. Please pause the video for a brief pretest. Click on the link below or go to this address. Why is oral health so important? Oral health affects our ability to eat, speak, smile, and show emotions. Oral health also affects a person's self-esteem, school performance, and attendance at work or school. According to the CDC, oral diseases, which range from cavities and gum disease to oral cancer, are responsible for causing pain and disability for millions of Americans and costing taxpayers billions of dollars each year. Cavities, also known as caries or tooth decay, are one of the most common chronic diseases of childhood in the United States. Untreated cavities can cause pain and infections that may lead to problems with eating, speaking, playing, and learning. Children who have poor oral health often miss more school and receive lower grades than children who don't. Per the CDC, about 1 in 5 American children ages 5 to 11 years old have at least one untreated decayed tooth. And children ages 5 to 19 years old from low-income families are twice as likely to have cavities compared to children from higher-income households. Healthy People 2020 recognizes this issue and has made improving American oral health care as one of its goals. Many adults know that good self-care, such as brushing with fluoride toothpaste, daily flossing, and professional treatment, is key to good oral health. But babies and young children don't and can't do it on their own. So why are baby teeth so important? Just as adults or permanent teeth do, baby teeth serve an important role of biting, gnashing, and chewing our food so that our bodies can readily digest the nutrients. Missing or painful baby teeth can make the child hesitant to eat certain foods, which can cause them to lose out on much needed nutrients. Another reason why baby teeth are important is the role they play in for our permanent teeth. Baby teeth are essentially a roadmap for permanent teeth to follow, and when removed prematurely, before the permanent tooth is ready to erupt, it can cause long-term problems, even changing the structure of the child's jawbone and face. The permanent teeth may come in improperly or possibly not at all, and your child will require orthodontic treatment to correct this problem. When do you start oral care? As soon as the baby is born. The CDC recommends gently wiping the gums twice a day with a clean cloth in the morning after the first feeding and right before bed to wipe away any bacteria and sugars that can cause cavities. Remember not to put your baby to bed with a bottle filled with milk or juice. When the baby teeth come in, start brushing twice a day with a soft, small bristled toothbrush and plain water. The CDC recommends for children younger than 2 years of age to consult first with your doctor or dentist regarding the use of fluoride toothpaste. Right about when the baby teeth start coming in, the child will most likely be grabbing. The American Academy of Pediatrics recommends giving the child a soft, bristled brush to hold on to, allowing you to brush the teeth and get the job done. While cleaning your baby's teeth, make sure to check them over. They should be all one color. If you see spots or stains on the teeth, take your baby to see a dentist. Bar any problems, your baby should visit a dentist by their first birthday. This can help alleviate fears and the dentist can spot signs for problems early. At this visit, you can also talk to your dentist about applying a fluoride varnish on your child's teeth. Help your child brush their teeth twice a day until they have good brushing skills. Use a pea-sized amount of fluoride toothpaste. It is best if you put the toothpaste on the toothbrush until your child is about 6 years of age. Make sure they always spit it out rather than swallow. Try brushing their teeth first, then letting them finish. If your child is showing signs of independence and insists on brushing on their own, then by all means allow them. Just don't forget to get in the habit of proudly checking them out once their work is done, and casually doing some touch-ups on your own for those hard-to-reach areas, and often neglected areas too. Set a timer for the recommended 2 minutes. Appeal to your child's taste. There are many types of toothbrush out there, and a whole line of character-based ones. If your child likes race cars or horses, then by all means get one that appeals to their taste. By letting your child choose their toothbrush, they can really get excited about brushing. Brush, Book, Bed is a program of the American Academy of Pediatrics. It is a simple nighttime routine. Each night, you help your child brush their teeth. Then read them their favorite book, or maybe two. Get to bed at a regular time each night. Having a predictable nighttime routine will help them understand and learn to expect what comes next. Additionally, routines may ease the stress that some families may experience at nighttime. Oral care for 6 to 12 years old. Baby teeth ordinarily start falling out about 6 years of age, and the molars in the back are usually shed between the ages of 10 and 12, and are replaced by permanent teeth by the age of 13. Your child may still need some help brushing until he's between the ages of 7 and 10. Even if his intentions are good, he may not have the dexterity to clean his teeth well, so continue helping. For long-term dental health, your child needs to care for his gums as well. He should be taught to floss regularly, preferably once a day, in order to help prevent gum disease in adulthood. Make sure your child has his dental checkups twice a year for cleaning as well. Regular preventative appointments will significantly decrease your child's chances of ever having to undergo major dental treatment. Also, contact your dentist whenever your child complains of a toothache. This plain could be a sign of decayed tooth. Your dentist may also suggest placing sealants on your child's molars. Dental sealants are a thin coating that, when painted on the chewing surfaces of the back teeth, the molars, that can prevent cavities for many years. Sealants protect the chewing surfaces from cavities by covering them with a protective shield that blocks out germs and food. Once applied, the sealant protects against 80% of cavities for 2 years and continues to protect against cavities for up to 4 more years. Despite dental sealants preventing over 80% of dental cavities, in a CDC report, only 1 in 3 children ages 6 to 8 had dental sealants. School-based sealant programs are a highly effective way to deliver sealants to children who are less likely to receive private dental care. Programs that deliver sealants to children at high risk for tooth decay also save money. Applying sealants in schools to the nearly 7 million low-income children who don't have them could prevent more than 3 million cavities and save up to $300 million in dental treatment costs. Currently, the CDC funds 20 states and 1 territory for basic oral health programs and infrastructure, and all but 2 states have some form of school-based sealant program. This concludes my presentation. Please take the post test, click on the link below, or go to the address at the bottom of the screen, and thank you for watching.